Hello, everybody. Welcome back to another interesting episode of the show, Behind the Scenes in Hell with Dr. Ron. With us today in the studio is Dr. Yusuf Shittu. And for those of you who have been asking me, is it possible to practice medicine and still be involved in health tech things and all of that? I guess you get your answers by the end of this episode. Thank you so much, Dr. Yusuf, for joining us on the episode today.
It's my pleasure to be here. Thank you so much, my boss.
It's really good to have you. So, without wasting time, I usually like starting from the beginning. Where did the journey all start? What inspired you to, become a doctor, and how did that journey sort of evolve into health tech, design, and entrepreneurship?
Oh, that's a very very big question. I don't even know where to even start to answer it. That's many layers. There's so many layers to
Yeah.
that. But I guess the best place to start is obviously from childhood. I was the first child, obviously, and for some reason they would always, everybody always, always see me as somebody that's was more amiable, was more compassionate, was gentle, and automatically those stereotypes come up. This one will be a doctor, will be very nice. Making for a doctor, and it didn't make it any easier. That I had a younger brother that was a bit more naughtier, and that was a bit naughtier than I am, and so automatically he became the lawyer. So it actually ended up being I ended up becoming a doctor, and he is actually still a lawyer. But generally, I'd always had this part of me that was a bit more compassionate and altruistic, and this humanitarian side, and I'd always been more interested in helping people, and as healthcare just draws to you as a profession. So I think it became clearer and clearer as I got into university. I got to study medicine, began to identify very easily like where my passion really lies. Beyond the stereotypes that we were forced to believe as children now. What exactly do I? And very early on, I knew that I didn't see myself being stuck to the four walls of the clinic. I used to say something then when I was in uni that there's a fixed amount of people that I can actually impact just by sitting in my clinic and waiting for one person coming one after the other for an injection or for a prescription or for something. But there's many more I can impact, by doing other things, including entrepreneurship. So I've always been that sort of person that looks at the big picture, that always wants to impact people on a larger scale. There's more or less system oriented in my thinking in that. So if there are 10 people coming to the clinic today, for those 10 people coming, there are like 100 that didn't make it to the clinic, or that could potentially
Absolutely.
make it. I've made it to the clinic, but they were hindered in some way. That what we're able to do for these 10 people, we can do 10 times better for the 1,000 people that possibly couldn't make it there. So I'd always been this out of the box thinker, and out of clinic space thinker. So very early on, I was always involved in various activities that added on various skills to me in uni. In medical school, I had my hands in almost everything from politics to writing to project management for event planning to public speaking. So many different things, because I knew all of us will graduate with an MBBS or a medical degree, but there's a lot that you need to do to stand out, and I wanted to be more rounded. I think that's what sort of set me on the path that I was. So I started a non-profit whilst I was in uni, out of my passion, to improve the way healthcare is delivered, especially for vulnerable people. We started basically offering free medical healthcare services to children, targeting mostly women and children. We're doing free outreaches, we're doing vaccination campaigns, those sort of things. That non-profit still exists to today. It's the New Child Initiative for Africa, and they're doing amazing work still. Well, I stepped back after doing some work there from the leadership, and after setting systems in place up to get into the world of an innovation, because I knew that it wasn't sustainable to continue to depend on donations to actually improve healthcare. And that was my very first foray into the world of health tech. In 2018, December, I took an important decision that some people might have thought that, oh, you just finished 2 years. I was just 2 years post
Yeah.
post MBBS then. And, and then I said, oh, I'm not going to work in a hospital again. I'm going to start a startup. Everybody thought I was crazy. Then so I was like, okay, well, I'd already built a foundation from running a nonprofit. I've seen a bit about what it does, or what it feels like to build an organization from scratch. Let's
Yeah.
try to explore the business potentials around what we were doing. And that's how really I found myself working in a startup and building it from scratch. And I've been on that journey from then till now, and there's been so much that has happened between then and now. So
Mhm.
I'm sure we'll get into all of that as we go
Yeah,
along.
definitely. I mean, listening to you speak, it's been like an interesting and inspiring journey, at the same time, from
Mm.
med school, running startups, in between doing social enterprise, then now finding
Yeah.
yourself fully in the startup world. I
Yeah.
mean, typically that's not the normal journey of a doctor in our normal climb.
Yeah.
Typically it would be a case of, okay, I finished MBBS. After MBBS, I do my house job. After house
Yeah.
job, I get into residency. It is a
Yeah.
very linear path, but some people
Yeah.
decide to look at outside
Yeah.
what happens. So now, all of this journey you've just painted now didn't come without challenges, right?
Yeah. Yeah.
What challenges would you say you sort of faced, along this journey, and how did you sort of navigate those challenges?
So I think the biggest thing for first of all is to understand your why and know exactly what your purpose is. What exactly? So some people want to dabble into health tech because it sounds fancy, or because people are or want to do something different without necessarily knowing why or what their motivation is. My
Mhm.
motivation then was I knew I had a lot of potential to do a lot of other things. I was able to freely just come up with ideas and new ways of thinking about doing things, and I felt that there are opportunities within that to actually improve things. And I had the way healthcare works, so opportunities within that to improve the way healthcare runs in general. I had a soft spot for pediatrics, for, looking after children and all that. And I'd always been, right from when I was very young, I'd always wondered, oh, why are children on the streets? Why are children out of school? Why are they
Yeah,
not having access to healthcare? All of that things, all of those things. And those were the underlying basis behind. So identifying and defining a niche was
yeah,
the first thing I had to come, and it was easy for me. I think the first experience that really set me off was when during my house job year, when, two children died on two consecutive night shifts from tetanus, just because they couldn't afford their parents couldn't afford the tetanus toxoid that they needed. Those things exposed me to the world of health inequalities, and why it was important to actually bridge those gaps. And so that's identifying the why is first thing. Then the second thing, and I think second big challenge, was really filling your knowledge gaps. I
Hmm.
think for me, we all graduated with an MBBS, but we knew nothing about business, and nobody taught us how to run an enterprise. And back in the day, people used to just set up their own hospitals soon after they graduated, because they
Yeah.
got the enabling environment was there. But how would you set up a hospital or run an establishment without actually having that business grit? And that's why a lot of healthcare or institutions fail, because doctors are not necessarily the best business people. So I had to, and I'm sure in a lot of ways, when the early stages of this, you're party to a lot of those
Yeah.
stages, when I was literally always, I was always at every one, event or the
Events.
other.
Yeah.
I was always in one class or master class, or because I was very, very eager to learn, to know, okay, and honestly, in those few months of running the startup on my own, before running out of money and deciding to
Yeah.
jump ship, I learned so much about what it means to actually run a business, what it means to found a team, what it means to hire people, what it means to put structures in place for your business to remain sustainable. So those things are things that people don't realize is part of the journey. And regardless of what aspect, whether you choose to own or run a business, or you choose to actually come in into an enterprise as an employee, those, it's important you know that this is an area that you're interested in. You have a very, very well defined purpose and why, and then you also have clarity in terms of like what it means because every health tech initiative, idea, project needs to be financially sustainable and viable before it can make the impact that it truly wants to make.
Yeah. Yeah, that's interesting. I mean, I think key for me is where you mentioned about, knowledge gaps. A lot of people don't sort of realize that, any form of transition or additional venture you want to get into requires you to like fill a lot of knowledge gap. I mean, I speak to a lot of people and, they say, how easy is it on this side? I'm like, no, it's not easy because it's like going to school all over
All over
again.
again.
It's not a question of your MBBS, you just keep it somewhere by the corner.
Somewhere.
Exactly. Start learning new terminologies, new concepts, new ideas. And honestly, that takes a lot of time.
Yeah.
So it's good you highlighted that so that people are actually aware that, I mean, it's not that straightforward. Now you sort of founded 3 startups. I think you mentioned briefly about the new child care. I think you run is it Shivent Technologies? We're gonna
Yeah,
come
so
to that.
I'll list them. For the first one, it was a non-profit,
Awesome.
the New Child Initiative for Africa, TNCI. The
Yes, yeah,
non-profit
yeah.
which still runs till today. Lovely, wonderfully spearheaded by Cassandra Akinde, who is doing amazing work. And we founded the enterprise, the non-profit together. So that's when I started. Then I started New Childcare, which was supposed to be like a spin-off or a startup spin-off of TNCI. And we slowly have now transitioned New Childcare into what we call MamaDoc now. Interesting. And we'll talk a bit more about how that came about. And then as part of some innovation work I did after being invited to the Unleash Innovation Lab in China, Shenzhen in 2019. I had worked on a project that involved developing a low cost non-invasive ventilator, and then that also spun out the company we call Shifa Technologies, which basically is focused on innovating low-cost technologies that can serve emerging markets. So that's the third startup, I would say. So obviously, with all of those different initiatives and organizations comes a lot of challenges and comes a lot of, one needs to be able to know how to navigate each of, because it's not a straightforward journey. And each and every one of them comes with very many different stories
Absolutely.
that we can surely dabble into.
Yeah. So when you look at, your whole journey with the whole 3 startups, I mean, we're going to talk about MamaDoc in a while. What are some of the biggest lessons you've learned about launching and scaling startups?
I think I would say that I think we get very, very, very engrossed in the idea. Always, we've got a fantastic idea. This is going to be very transformational. But the truth is, the work is actually in the implementation, and the execution of that idea. So no matter how fantastic an idea is, no matter how brilliant it is, if you don't have the right resources, the right team to execute that idea, it's almost as good as nothing, right? So the work is in the implementation. I'll say it's like a 20-80%. So you have an idea, you get excited, you feel like it's going to save the world. But at the end of the day, it boils down to you actually doing the work. And in doing the work, you need to find the right people. You need to find the right resources. And that's not definitely easy. So startups that I've worked with, so through a lot of what has in that, has been the difference between success and failure with the startups I've founded and worked with is sometimes, the unavailability of resources to actually, progress your idea. Because to be honest, if you don't have the finances, if you don't have someone backing you, especially for instance, with the medtech, a company with Shifa Technologies, a lot of the roadblocks are around finances, finding funding to be able to progress clinical trials, because medical devices are very regulatory intensive. You need to make sure that you've got the right regulatory approvals before you can go into set, even if you have the best product in the world. And there's a fine line between being able to de-risk a project or an initiative so much so that investors can now trust it and say they want to put their money behind it. Well, you need to get yourself to that point where it has been successfully de-risked. You need to get it over, because people don't want to put their money in too early, because they feel, okay, what if this doesn't work? And you don't pass your clinical trials. But then the truth is, you can't pass your clinical trials if you don't actually get the money that you need early on. So it's like a chicken and egg situation. Yeah, so if you don't find the right resources and you don't make the right connections, resources can include finances, meet the right people. Sometimes, the project might not, the concept or the initiative might not progress as you want it. The other thing I would say really is you can have, I've learned that you pivot and pivot and pivot until you hit what works. And I'll give the example of new childcare. I think maybe this is a good time to transition into how we came about MamaDoc. Because if I tell you the amount of times we've pivoted new childcare as a startup, that's where we started. We started first of all, what we started off as a school health service, basically delivering healthcare to schools and doing. I quickly realized after
hand
doing a few months,
washing
doing all the
classes, hygiene
hand
and
washing
stuff.
classes, and then doing all these health outreach screening checks for schools and all that. It was really very exciting, but very quickly we realized that these schools are not ready to pay anything, and parents are not willing to add any more money to their school fees just because of one doctor is coming over to check them every now and again. So that was the first, and we've pivoted so much after then, up to the point where we decided, okay, right, we're not making any headway by being a service-oriented business, by being a business that basically, because of the attitude and the behavior of the consumers, right, around accessing healthcare. We transitioned from being a school health service to a virtual healthcare platform, a telemedicine platform, to a home vaccination platform. We've done so many different things. But what we then realized was people actually know how they want to buy services for their children in terms of they know they have their own preferences. Sometimes it is actually, then realize that sometimes actually, the knowledge and the support around parenting that is more vital. So we switched our beneficiary from the child to the parent. So the target customer became the parents, because we realized that, okay, we support the parents as best as possible. They'll be able to look after their kids, and it's still in line with our vision. So you can't be too stuck to a way of doing things. An idea. Oh, this is how I must do it. This is the only way that this is what I'm passionate about. I will do it. I'll stay there until it works. You'll stay there for very long. As long as you continue to find a way to serve the same, segment of the population that you find that you're passionate about, and you would always find new ideas. It's always best to listen to the customer, listen to the market, and let the market determine how you proceed. If tomorrow people say, oh, they don't like buying knowledge, they don't want a supportive community, we don't feel like it's working, we'll find a new approach. At the very beginning, I was very against us doing work around maternity and pregnancy, because personally, my own passion is from postpartum. It's for, okay, after this baby is born, we now need to support. Or realize that, where people actually need more help and support is oftentimes where they are most vulnerable is oftentimes pregnancy and birth in general. Yeah. So I'll just keep it at that for now.
So this is basically how you guys sort of evolved to the point of, getting into MamaDoc, right?
Yeah.
So looking at what you guys do at MamaDoc, because I know that I follow your, most of the posts you guys do around MamaDoc and all of that. You tend to, or you sort of specifically maybe targeting Black, migrants in the UK who might be struggling with accessing healthcare services. Because I've also sort of seen firsthand how difficult that journey is for Black migrants who are pregnant in the system. Don't even know where to get this one. You're looking for this. It's as if that support is almost non-existent. So how is that going on so far? What's the impact of that?
So and you're perfectly right. We pivoted, at the start of this year into literally focusing on on Black migrants. I'll just give a background to how that's happened.
Yeah.
We were initially obviously very passionate about delivering services to Nigerian women, which we still continue to do, back home. But we realized that with the economic downturn back home, a lot of people were deprioritizing engaging in any other thing that's not putting food on their table, or there's not, so we decided, since given our own experience as well, I realized that there's actually a significant gap here in the UK in terms of outcomes between Black women and white women.
Yeah.
Black women being 3 to 4 times more likely to die or have pregnancy complications. We're also hearing stories, so many horrible stories of, a lot of our friends and connections and family that are in the UK here about their experiences. A lot of people needing, cesarean sections. Almost everyone that has given birth in the UK needed emergency cesarean section. Not necessarily because was needed, but because they always end up in a complication or the other. So we decided to dig deep into this matter and see what exactly are the underlying issues behind this. And the things that we're hearing from women that are giving birth were beyond heart-wrenching. Talking about feeling neglected, when they had issues around early pregnancy, not knowing where to access what, or having to wait for the GP without getting an appointment, and suffering. And, so issues even before they even get to delivery point, just even during the pregnancy, booking, and not being aware of their rights, not sometimes wondering if actually booking an antenatal or accessing GP services or maternity services will affect ILR, or if it means they're claiming benefits or those sort of things. So we saw that there are lots of knowledge gap. They don't know where to access what. And we found ourselves in that sort of situation too when we were raising our little one. We literally had to find all the resources we needed by ourselves, whether it's pregnancy support, whether it's mental health support, whether it's breastfeeding support. And there's so much available in the UK. And there's so much locally available to each area. So what we're doing as MamaDoc is we are collating all of those resources into one place. We are partnering with all of these charities, fantastic charities that have been existing for years and years, that Black women generally, or Black and brown women, would generally not be open to just reaching out to these people or engaging in their circles. So we are pulling them together. They are our resource partners. A lot of them very, very impressed by what we are doing. And what we are now doing is we're now taking that information, condensing it into health education videos and all of that we are sharing with these women. What we are seeing is that a lot of people are developing a lot more clarity about what is expected, what pregnancy in the UK looks like. We hold one-to-one sessions with women, early pregnancy, to talk about, to help them understand what exactly it means to be pregnant in a new country, what the journey is going to look like, and to help them put some steps and plans in place and put some measures, because nobody is going to tell you that you actually need to make sure that you start applying for your visa for your parents or for someone to actually on time, so that they get ahead of time, so that they will come in at a good time. Because only 1 week, my mother-in-law arrived only 1 week after we delivered, and I know what my eyes saw. What both of us we saw before she arrived. It was Uber Eats and Deliveroo that we're using to survive that period.
Yeah.
So people don't realize that there are certain things you need to put, and even in terms of birthing or delivering, there are certain things that you need to understand about how the system works. Back home, there's nothing like birth partner. There's nothing like birth planning. But you need to make sure that you have planned your birth. You know what your choices will be, and in the eventuality of something happening, you know exactly what to, so they can, because it's more patient-centered here. Back home, we're very used to doctor says this and that's it.
That's all,
here, they want to be involved. They want you to be involved in your care just as they would like to. So those are the ways that we're helping these women plan for birth and improve their outcomes so that they can speak up for themselves. So a lot of the women were supporting the report coming, feeling like, it was very impactful that they had engaged with us, that help them understand the lingo when they are speaking. They know exactly what choices to make. Because as a migrant, you just come into the system and you're just nodding. Just say, okay, they give you this
Not
option.
really
You don't know
understanding what's
what
being
the
said.
exactly. You don't understand what's being said. You don't understand what the implication of a choice is. But you don't want to claim that you are totally ignorant, and you just go along
Yeah.
with the flow, and it doesn't always lead into the right outcomes. And that's what we're
Mhm.
trying to prevent.
Interesting story there. I'm just sort of looking back, all the challenges, because I think a lot of community building is also going to be involved in this.
Yeah.
How are you guys sort of managing communities around this product or service?
And that's the thing. I think it's the cornerstone to this sort of approach is that building a community, making people feel like they're part of us. I think myself and Nima, we try to make sure that my Nima is my wife, by the way. She's also a
Yeah.
doctor, a GP in training, and she does more of the maternity stuff because she's got the background and experience and interest.
Yeah.
But the thing is, we try to make it feel natural, like we're just sharing our own experience with everyone,
Mhm.
and make people see themselves in us, because we're just like everyone else, and we share similar background and challenges, and slowly we're telling our story and hoping that everyone identifies with that. What we envisage to do more of this year is create those physical spaces, because we're doing online engagement, engaging these women online, but we want to be a lot more physical, so we are tangible and they can see us, they can ask us questions, and we want to do that through social engagements, because even parenting is hard enough, people don't have time to actually socialize, and
Absolutely.
people don't even people are most migrants are all about, oh, what's the next shift, how do I make money, how do I make money? But to be honest, we need those opportunities to engage and interact, so that even not just us, our children would also build new circles and relationships, because that's how you form the support system that you need in a new environment. Because Nigeria, we have a family, or back home, wherever it is, we have family all around us, so we don't have to think about the village that you need to raise a child. But here, you
Yeah.
need to raise that village by yourself. You need to look for your own tribe, and that's what we're trying to do with what we're around the initiative.
It's interesting. Well, we'll keep watching out, and wish you guys the best with
Thank you.
MamaDoc, right? So let's look a bit about your journey, sort of taking you back now. So a lot of clinicians sort of want to move into health tech or innovation or whatever, but they really don't know where to start. Looking at your own experience now, if I was a newbie asking you this question,
Yeah,
what advice would you be giving me?
I get this question quite a lot. I think what I usually end up saying to people is this: you need to fall in love with the problem. You need to fall in love. You need to find you need to find something that you're truly passionate about. Health tech is not about building fancy technology that's kind of applicable to healthcare. It's about actually looking for interesting, wicked problems to solve. And it's just like healthcare is a gold mine of opportunities or problems as well, that you can actually create solutions around. And I think first thing is identifying problems and knowing what you are interested in. Two is also taking advantage of of whatever experience that you have as a medical professional, or in training as a medical student. If you've been asked to do a project or something, take it seriously. Look at, is there a technology angle? Is there a way we can think about this differently? Is there a way we can apply technology to, if you've been asked to do a research project, make sure you're researching an area you're interested in and find a way to apply technology to it in some way. Because the truth is, you would reflect on those experiences whenever in the future, whenever you want to get into a health tech role, or whatever you want to do, those interviews where they'll ask you about your experience. And if you just, oh,
Yeah.
I'm just somebody that is interested in health tech. Sorry. Interest is never enough.
It's
So
not
you need
enough.
to you need to combine that interest with a passion, and actually you need to have created opportunities for yourself to apply your interest in health tech, and that's by working on projects. sometimes even initiating projects. And I'll give an example. When I was doing my undergraduate research, my research was in preconception care.
Okay.
It's literally, if you look, and that was in 2015. I presented that research at University of Oxford. Then that was in 2015. That's as far back as when I've been thinking about applying my interest into what I'm doing. So,
Yeah.
think about between then and now, that's over 10, almost 10 years now, still in that area of work. Whenever I get the opportunity to work on a QIP project, on a quality improvement project, I always think about how to apply technology. How can we do things differently? And those reflections. So, for instance, when I did my master's also in healthcare and design at Imperial, I made sure I worked on a live project. I was within the NHS Trust then, looked at how do systems work? How do we use AI to prioritize patients on NHS waiting list? Because I wanted to understand how systems work, how we can use design thinking to influence the implementation of projects, and how high level projects actually work, and what the challenges are involved in executing a project in an NHS trust, for instance. So take advantage of opportunities that you have. It's not about having another degree. It's not about, I need to get a qualification. You can get all the qualifications, but what did you do with that in the world? But what did you do with that qualification? That's what's most important. What are the experiences? Those are what people ask you in interviews. So it's either you want to be a founder, you want to start an initiative, or you want to be a part of an existing initiative. Either way, you would need to have a strong foundational passion. And you also need to have applied yourself in a different, an interesting way to be able to succeed.
That's interesting. I mean, key for me is the need to actually engage in live projects or whatever project that sort of allows you to maybe build portfolios, if I may use that word.
Yeah.
Because like a lot of people these days sort of tend to focus, okay, certification, qualification, but when you start asking, okay, what have you actually done? Because to be fair, a lot of people these days are after what you've actually done rather than what qualification
you have.
Exactly. Because I remember one of the interviews I had, nobody was even looking at how many degrees I had. The question was more around, okay, what have you done? Oh, okay, you've done this. You face the challenge. How did you guys navigate those issues? Those are the things they were looking out for rather than the qualification. So I totally agree with you. Getting your hands dirty is really, really very important. And I think as we were speaking, I also sort of reflected on my own journey too, because I think all through our sort of hands-on, in hospitals where I'd worked, implementing EMR systems. So I was like actively involved, asking the tech people, what's this? Why is it down? I started hearing things like servers, like database, that's when I started sort of picking up all this lingo.
Yeah.
And looking back now, that is what I'm working with now.
Yeah.
So yeah, that makes a lot of sense. Yeah. Then you mentioned about your MSc at Imperial in, I think, is it healthcare innovation? What was it again?
Healthcare and design.
Healthcare and design. So how impactful would you say that MSc has been to your career so far? Because one of the questions I come across a lot is, do I really need to go and pay for another MSc in the UK or Canada or US? How valuable is that?
So the first thing I'll say is that it's not about whether I considered it valuable, but you don't necessarily need an MSc for anything. So the first thing that needs to come off everyone's mind is that you don't need an MSc. Yeah. So so you don't necessarily need an MSc. There are fellowships, there are loads of opportunities, internships that you can get that will give you the same quality of experience and exposure to the concept that you're interested in, But an MSc, for me, I wanted that opportunity to create a different circle around myself, to expose myself to a new way of thinking, and also to provide myself some academic validation. I didn't necessarily need it when you look at it in the grand scheme of things, but it is sometimes a conversation starter. It is sometimes, for me, the biggest value also is even my cohort, like the relationships I built with people, because I learned even more from those people in my classroom than some of the teachers on the course.
Yeah.
because you see that, on the course, I chose healthcare and design because I'd always been someone that's used to thinking innovatively about how are how are things made? Why is this the way it is? Why is this designed in the way it is? And
This way.
everything that you see in this world is about design. Someone designed the door to actually, be in the way it is, in the shape and the way, in the form that it is. And in healthcare, we often don't think about design because we often get shoved with solutions from top down
Exactly.
without actually thinking about the user. And that's where we get it wrong, because people actually, we need to use design thinking to understand what would people prefer, to understand how to design products, services in a way that actually works for people. I felt that MSc was going to be applicable to so many different things that
Yeah.
so the choice of the MSc is also very important. Not just so I want to do an MSc or master's just for the sake of it. Just so I want to. If you do an MSc that you are not interested in, trust me, you will regret yourself, your time, you will regret your life because it is hard in terms of like working on a dissertation. I know how difficult it was, but I also wanted to create an opportunity to work on something that will allow me expose myself to different concepts in digital health, and I got that through the project I worked on as part of my MSc program. So it's good, but it's not necessarily, it doesn't have to be that. You don't have to get an MSc before you are able to land a role in health tech, or before you are able to further your interests. So there's so many people that go straight into a fantastic health tech role just from their foundation year. After completing their foundation year, they've done that because during their medical school, they've already started early on working on projects. They already have so many fantastic experience to share. And that oftentimes is enough, because trust me, wherever it is that you work, you still need to learn the ropes, and you still need to, retrain yourself.
Yeah.
Yeah, but it's always valuable if you can add on certain qualifications, but it needs to be a calculated
Decision.
decision, and you need to know exactly why you are doing it, because it will just be unnecessarily money spent and time wasted if you don't make the most out of it.
I mean, the part I was just thinking, like that dissertation part is it's just a nightmare. And somebody can go for PhD. I said, no, I think I'm done.
I
No,
think I'm done.
I
That's
don't
the
want to relive that period again. No,
again is the worst thing. Those 15,000 words need to come from somewhere.
God, no, 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 no. I don't want to go back there. It was a good experience though, but no, I think I'm done with that now.
Same.
So you wear so many hats. You're a
Yeah.
GP, you're running MamaDoc, and so many other things. So how are you able to find that balance really? Because I think this is where a lot of people sort of struggle. Though, how do you balance running all of this still with family side of things?
To be honest, it's not easy at all, and I wouldn't recommend it to anyone. Because I think part of it is my sort of neurodivergent brain. I've always not focused or worked on something solely. Right from medical school, I've always been the sort of person that does many different things and juggles many. I think it helps me become more productive in the way that I function, because I'm able to get something started and get someone else to run with it or complete it, or I think one needs to be able to understand, you need to be able to understand yourself and your strengths to be able to maximize, your abilities. So I think from time I'd already known that I'm that sort of person. So I work a lot with people that are efficient, sometimes completer finishers, that are able to run with the ideas that I start, and I'm able to delegate and say, okay, I've started this. Oftentimes I coordinate like multiple different teams almost at the same time. Even as not as TNCI is as a non-profit, I still make input if and when I can. But I make sure I empower people to actually take responsibility and initiative. And
Yeah,
you have to invest in your relationship with people to be able to get that out of them. Because if you don't, no one will complete or finish a job for you. So time is always difficult. It's always an inestimable resource.
it's
But
never
I
enough.
try. It's never enough. It's never enough. And what I try to do is I try to prioritize what's important. For me, family comes first over everything. So I try to make sure I dedicate special time for, for family. And I try to make sure I compartmentalize my week in a way that I'm able to work on certain things at certain times. And so, for instance, I work maybe 3 to 4 days a week as a GP, but in the morning on my way to work, I'm doing a catch up with my community and partnership manager, or over lunch break I'm recording a voice note to say something that they should complete that needs to be completed, or after my work hours I'm taking a meeting. So it's difficult, it's busy. I have to force myself to make sure I maximize my calendar so that things don't clash. So you need to find a way to be organized, so that you can maximize your time, because if not, you find that you feel like you're burnt out, you're just running a rat race. And you need to also prioritize self-care. It's very important, especially if you're going to be dabbling into many things.
Yeah.
So there are times when I have to literally just, okay, we take a break for the weekend, we shut down for that period of time, only to reboot on Monday morning.
Yeah.
It's very important. So I think that's the only way to survive it. And I think it is possible, but you need to understand and know yourself and know what your strengths are before you dabble into it.
Yeah. I think for me, self-care is like my own, sometimes I just go offline, you know, just disappear, then reappear after a certain while, because
Yeah, it's not
you
worth it.
first, exactly,
If you're not there, the world will move on.
will
Social
move on
media will
very,
move.
very quickly, very, very quickly. So you mentioned earlier on that you sort of attend a lot of conferences, a lot of networking events, and all of that. How important would you place this, for somebody who is looking to get into this side of things? You think is a priority one to always attend every conference, or what's your advice?
I think it's highly crucial. I don't do it as much as I used to back in the day, because I don't have as much time.
Yeah.
I wish I had and I'm glad to have qualified as GP now to have a bit more flexibility, and I can plan around some of those things. But the biggest thing really is you won't be able to attend every event. That's the truth. So you need to be selective about what you give your time to. And you attend some events because it aligns with your passion, because you think that people that possibly align with your passion or will be interesting to network with will most likely be interested in that and will want to be there. So oftentimes it's not just about the topic, it's about the sort of caliber of people that will be interested in those sort of engagements. But relationships are crucial to building a role in health tech. If you don't network with the right people, nobody will know what you know or what you are interested in. And if you get to these events, if you don't actually speak to anyone, so I remember every event. I remember every event I've attended. There's always one standout person I've connected with.
Yeah.
So it's not about the quality or the quantity of people. It's not about, oh, you just get here. I meet these ones, meet everybody, and at the end of the day, you don't
You
connect
met
and deepen
nobody.
those relationships. Yeah. So it's about the quality of the relationship over the quantity. So even if it's one person that you manage to connect with, honestly, that person can link you to like 5, 10 people after the event. If there are people that I've met, just one person I connected with, and the next thing it is, I'm being invited to a group chat of other amazing people that are looking into the same thing, and I'm like, okay, then there we are. So it's about the quality, not the quantity, and be selective, obviously, of what you. But it's important to get yourself out there and to meet others.
Talking about getting yourself out there, I see you also sort of do a lot of LinkedIn posts, though maybe not as much as, because you even criticize yourself sometimes that you're not posting as much as you ought to. So, but yeah, how important do you think that is for everybody who's sort of trying to build a career, in terms of visibility and putting yourself out there?
Yeah, I think it's highly crucial. LinkedIn is a very, very interesting space because there's lots of professional. A lot of people have moved on to LinkedIn. I think after what's been happening with Twitter, a lot more people are interested in LinkedIn now. And it's beyond just a platform to just celebrate successes and see people gaining promotion, but it's a platform to also share your stories and your experience. So how you actually share is important to how people connect. It's not only when you have something interesting or new to share that you come on LinkedIn to announce. It's also about sharing the failures and your journey. And I think that's what I've learned mostly, that people actually connect with your journey even more, and they're watching you. Like with every LinkedIn post, they're seeing how you're progressing and your experiences, and it sort of builds trust. It builds that. So you want to be someone, someone of a key person of influence. You want to be that sort of person that they think about when they think about the subject matter. So you want to be a knowledge, key person, subject matter expert. You want people to actually think of you in relation to something, and that's the biggest thing, because sometimes you can oftentimes be all over the place, and it might be difficult to place you on LinkedIn. It's important. Your experiences are important, but it's important to harmonize them as well, and to at least maintain some reasonable level of consistency. I could always do more. I wish I could, I could post a lot more than I do. But it's definitely a platform that, especially if you're looking for opportunities, if you always hang around there, if you're always connecting, and it's not just about posting, also commenting on other people's posts, celebrating wins. That's how you build relationships. There are a lot of things on LinkedIn that come across, just by being present and just by building genuine relationship, DMing people, asking for opportunities to connect and speak to them privately for mentorship. Another thing that people don't realize is through LinkedIn, you can see people walking the path that you want to walk.
Yeah.
And you can then find out from there, is it actually worth it before you even dabble into that?
Something.
So you see all the degrees that they've accumulated, you see what they landed, and you now ask about what's your job like, and they tell you, oh, this is what it is, and you're, no, this is not what I envisaged, or this is not the pay that I actually envisaged. That after doing all of this, so it saves you some time, because I tell people, if you're interested in this, go and look at the people that are doing this in large scale, or in the way that you envisage or dream about, and try and connect with these people. You'll be surprised how open people are to actually support others and mentor and, give their own feedback. And, you never know where that relationship could lead to.
Yeah, that's true. I mean, I remember when I was trying to sort of put my own, what you call it now, career roadmap in health
Yeah.
tech together. I know I spent a lot of time on LinkedIn looking up people, okay, which courses have they taken, or what certification have they taken to get to where they are. Also spoke to a couple of persons to you say, okay, what do you actually do? Okay, you're head of this. So what does that mean on a day-to-day basis? Let me have an idea.
Yeah.
Is this what I want to be doing? Because again, some of these titles, they sound very exciting. But when you get into the details, you are sure that you don't think that's where you want to get into. I think to a large extent, it's helped me also sort of, take out some roles that I thought was my role or something I was looking up to, but I've managed to knock those ones off to say, okay, this one is not for me. So I've sort of narrowed that down. So yeah, LinkedIn, very good. The other question I wanted to ask, so you also work as a medical advisor, though freelance, right?
Yeah.
So how is that going on? Because one of the questions I get all the time is, I want to get into medical advisory. I want to get into medical advisory every time. I'm like, it's not really that straightforward the way you are hearing it. But from your own experience, what has that journey been like?
To be honest, it's not as fancy as it sounds. I actually did my master's, and I felt, oh yeah, I will be doing a lot more medical advisory work and all of that because of what. But it's not as fancy, and people won't tell you. It's not. It's a very niche area. People are always looking for a medical expert, expert in a niche that can advise them specifically, or advise a company specifically on an area, on a project. So sometimes it can be very, very difficult finding that match. As medical advisor now, you see it there. Online applied. I got into I saw the opportunity on LinkedIn and I applied. But in actual fact, I've not worked I've not been matched with a project.
Wow.
people get. So not many people realize that it's not that straightforward. Not many people realize that it's not as lucrative that you would think it is.
Yeah.
It's not something. Yes, there are a lot more clinicians now interested in
Mm-hmm.
advising health tech companies, and that sort of saturates the market. So you need to differentiate yourself in some way. You need to have a niche. You need to be a subject matter expert. Goes back to being
It's
visible on
something.
LinkedIn, so that they know that, okay, if there's something that relates to this area. So I do a lot more. I think a lot of the medical advisory work or experience I've gotten actually in a different sphere, so yeah, or in a different way, sort of the engagement comes oftentimes in a different way. So people see what I post on LinkedIn, you see what some of the experiences I share, look my bio up and feel, okay, they might be able to. So for instance, I was once approached by a company in Estonia looking to set up a UK, wanted to do some entry into the UK market, especially in primary care, and I felt that would be someone interesting to speak to. That was one engagement. Also, charities that are looking to develop healthcare content that relates to maternal and child health, and they're looking for a subject matter expert to actually deliver that content. And this all is only because of what I share and what I post and what the experiences I've had. So it is actually your experience that will determine what people, and oftentimes people seek you out rather, so they would actually message you and reach out to you rather than you actively applying to these roles.
Applying to those roles. Yeah.
Yeah.
That's interesting because I mean, in the past, I think I've done a couple of consulting gigs anyway
Yeah.
around, EMR, power building solution, and they're looking for clinical inputs. Again,
Yeah.
I think came from a recommendation. I think this is the guy I should be talking to because he's been sort of doing this for a while now.
Yeah.
So he's probably more grounded. So again, I think it's just building that sort of competence, getting into a niche area where people sort of, know this is what you do and, and share the much you can on
Mm.
LinkedIn. So another question, I mean, this from my community now. The where a lot of people or clinicians sort of also struggle is what kind of skills are they able to take from the bedside to move into this other side of medicine? So
Mm.
because a lot of people have a lot of skills, some people they are not even aware of what skill sets they have.
Yeah.
Talk less of which ones can we now safely use to transition to the other
Yeah.
side. So looking at I mean, you've tested both worlds, right? You're in
Yeah.
both worlds, not even tested. So what key skills would you say are very important from a clinical perspective,
Yeah,
relevant on the
transferable skills. I think this comes a lot when it's from imposter syndrome as clinicians. When we find ourselves in a different environment, like, okay, what do we actually know in this new space? So we realize that there's so much you do know from your day-to-day engagements with patients and just from working as a clinician. So we are trained to be problem solvers. So we're trained to look at a problem and look at just one symptom and flesh out very different facets of that problem and look at how the pieces, how the problem pieces together. You sort of frame a problem. You develop a problem tree, whether you like it or not, in
Yeah,
your head. When the patient comes to you with a cough, you developed many different differentials, and you're
yeah,
thinking, okay, what was the most likely diagnosis from all of this? Based on the patient's experiences, exposures, their symptoms, and the social determinants around their health as well. So you're thinking about their age, their demographic, all of that. So we're trained to be problem solvers. So problem solving is key when it comes to technology and the way we do it. So you understand the root problem and you see how we can look at ways to solve it. We're also very good at communicating, whether we like it or not. You've got to communicate with your patients, you've got to relate, and you've got to communicate your ideas and solutions in a way that, you get stakeholders involved. You get, because you can't do anything in isolation. You need to convince people that this is an area to invest in, or you need to
yeah,
get people on board. You need to mobilize support, so
yeah,
we are trained to be able to communicate. Another thing that we are trained to do essentially is also project manage. So we are able to work with various interdisciplinary teams to
yeah,
look at who is the best person to look at this patient's problem. Is it the surgeon? Is it the obstetrician based on patient presentation? And stakeholder mapping is essential to any health tech work. You need to know who are those involved, what do I need to bring in to be able to achieve it, and how do I work with people? So teamwork, team building is also important. As a doctor, you can't work in isolation. You got to know where your limit is, and who are you working with to collaborate to achieve that objective. And you do that is essentially because as a clinician in health tech, you will not even you probably will not even know a line of code or don't know anything about coding, but
Absolutely.
but your own input and your input as a clinician is not to become the coder or become the health tech expert or the AI expert. Your own is to look at how this would actually play out in terms of patients. So your expertise is in your understanding of what it means on the user side for the patient. How does it work? For the healthcare system, for work clinical staff, and that's the input that they don't have. So AI people or tech guys will be able to think about the technicalities of everything, but don't know those minute details about how it actually what it means in the healthcare world. And that's what we should hone as a clinician in health tech. You should hone that aspect. You shouldn't be shy to say, "Oh, this is all I know." That's what they need oftentimes.
That's what they need, actually.
They often need that understanding. If you are lucky to have both skills, it's great. But oftentimes they need just simply that.
Yeah. And to be fair, I remember one of the implementations I worked on, and I was looking at the solution. I'm like, no, this is never going to work because this is not what happens in a real life hospital.
Real life,
right?
yeah.
You guys have built your solution, fine, but we need to go back to the drawing board. This is not going to work. Yeah. And they're like, I said, no, right from the beginning, when the patient walks in, this is not what that journey looks like. And you have to mimic that journey. You can't build something else that doesn't correspond with what the actual journey is. And I think at the end of it, they were really appreciative to get a clinical input into what they were building, really. I think recently, a lot of tech companies are beginning to sort of bring in clinicians, nurses, physiotherapists, depending on what they are building, just to get that clinical view to make sure it's a robust product we are building. So I think I like how you sort of highlighted some of those, very key transferable skills, because to be fair, it's what we do every day: problem solving, teamwork, stakeholder engagement, communication, and all of that. And that is what I use on this side of things, really. It's just sometimes I might need some technical whatever, but that's all I work with like every single day, really. So I speak with a lot of people and I tell them the same thing. I mean, these are the skill sets. You don't need any new thing unless maybe your work is beginning to be technical, where you now start learning some new software or whatever. Remember when I had to start learning, is it Visio, for process mapping, how to use Visio, and I'm like, what is all this? But yeah.
Well, the thing is, we're teachable. We're very teachable. We
very,
grab things.
Exactly.
We grab
pick
things
stuff very
online.
fast.
We just need some time. So we've got to, because how much time do you actually have to learn the whole of the anatomy of the human body? As complex as it is, and you still manage to smash it. Yeah.
Exactly. Very, very connect. So, just wrapping up now.
Yeah.
I mean, if you could change one thing about healthcare system, what would it be and why?
I think the top-down approach to the way healthcare solutions are delivered is what's one thing that we oftentimes don't start with the user in mind. And this doesn't happen in a lot of other fields. And that's one of the reasons why healthcare struggles. I think so because of the delicate nature of healthcare, very, rightfully so. Obviously, we're dealing with women's lives.
Right.
But I think if we engage with users a lot more, if we understand what their needs are, what their preferences are, obviously people are different, and if we spend a lot more time, half the money that we spend commissioning very large projects, and only to discover that this would actually not work. We spend only a fraction of that, starting from the rock bottom and asking what matters most to patients. We discover that solutions are actually going to be very simple. They're going to be not necessarily need to be the most fancy solution or the most tech-heavy solution before they can actually work for people.
Mm-hmm.
So an example would be a case in primary care now, for instance, a lot more practices are adopting triage. So like, triage systems to monitor the way to, look at the way they can stratify the patient presentation so they can match them to the appropriate clinician.
Yeah.
And determine when patients can be seen. So rather than making patients wait 8 a.m. for an appointment, everyone comes and fills an online form. But you see, I spent almost 30 minutes arguing with the patient who was like 90 years old. Was telling me that this system is biased against people like him because it can't is not tech literate to be coming to fill an online form. And by the time he comes on the phone, those people that are on the online form, they've already taken all the appointments and there's nothing for people like him. So you see where technology, despite how efficient it sounds, oh, this is fantastic and brilliant, which is, in real sense of the word, we should embrace those sort of things. But, you have to realize that there are certain people that can be disadvantaged from certain. And if you work with an inclusive mindset, right from time, looking at the various groups of people that will be needing to access, you can create various levels or entry accessibility or equitable measures that they can access without feeling disadvantaged. And that's, I think, a perfect example to show that it doesn't always have to be a straight line. We need to adopt rather than, and we have this fantastic idea. Someone has convinced the CEO of the hospital to buy this EMR or to buy this solution, and then everybody is now forced to be trained, whether we like it or not. It doesn't work for us. And that's often what happens. They spend so much money, so much time, and then the system crashes. People don't use it. If we actually ask people the right questions at the very beginning and we understand their needs, we'll be able to arrive at those solutions that will actually work better for them.
Yeah, thank you so much. So where can people connect with you and sort of learn about things you do?
LinkedIn is the best place.
MamaDoc?
LinkedIn, Yusuf Shittu on LinkedIn, Dr. Yusuf Shittu. On LinkedIn. So just, once you type that in, you should find me. And then on Instagram, ask MamaDoc, ask MAMADOC on Instagram. And my personal page is TY Shittu, TYSHITTU on Instagram as well. So feel free to connect, feel free to ask me questions in my DM. I might be slow, but I'll try and get to them.
I'll probably get all of those details and put them in the comment or the description section so that people are able to connect with you. Then one last question. I always get a question around mentorship. So are you open to mentoring people? Because I get that a lot.
Well, I am still a mentor to many people, and because of that, so I have many mentors. I'm a mentee to many people, so I have many mentors, and because of that, I have the responsibility to pass on the torch and pay it forward, because I didn't get here all by myself. So I obviously still have a long way to go myself. So I'm usually happy to help people on.
Okay.
Make it clear what my limitations are in terms of what is humanly possible.
Exactly.
But plus feel free to reach out. Yeah.
All right. So if you're watching, feel free to reach out to Dr. Shittu. He's happy to mentor, but please again, just give him small space too, because he also has other things he's doing. Let me just check if there's one more question from the community. No, I don't think there's any other question. So thank you so much. It's been interesting, catching up with you, talking about everything you do, MamaDoc, TNCI, Shifa, and the rest of them. And I hope the viewers have sort of, enjoyed this episode as much as we enjoyed putting it together. And well, we'll keep in touch and keep seeing all the beautiful things you guys are doing. And for those watching, YouTube says only 80% are subscribed. Please hit the subscribe button so that other people can get these interesting episodes we share on here. And until I see you guys on the next episode, it's bye for now.